This is the third in a series of lectures on the endocrine system. We're going to be talking about the hypothalamus, the thyroid, and the parathyroid glands. Including down from the hypothalamus, the pituitary gland is split into the anterior and the posterior pituitary. And the command center goes like this. First, it's the thalamus. It's receiving all that input from the special senses, as well as your thoughts, of course. And then it directs that information to various parts of your brain, including the hypothalamus. And then the chain of command continues to go down to the pituitary gland that's divided into the anterior and posterior pituitary glands. And they delegate most of the duties, but there's quite a bit that they do not do. So visually, this is what it looks like in your brain. The thalamus is receiving all that input from the special senses, the smell, vision, hearing, touch, taste. And the hippocampus is storing memories. And the thalamus may delegate some of that information to the hypothalamus, here depicted as the captain. So these are all the things that the anterior and posterior pituitary glands do. These are all under the direction of the hypothalamus. And this is just pretty much a summary slide showing all the different things. These are managed by two separate lobes, and they have two different types of communication from the hypothalamus. And then all of these are directed through negative feedback loops. All of them except for oxytocin, but we're going to be getting into that later. Starting with the anterior pituitary, it travels in this capillary stalk going down to the anterior pituitary. That's the first difference between the anterior and posterior pituitary glands. And it goes through this portal system, this vascular supply, and it's called the hypophyseal portal system, carrying hormones. So the hypothalamus is creating hormones, transporting them through this capillary network into the anterior pituitary gland, which subsequently makes its own hormones in response. So I have this porter here carrying baggage like a hotel porter as an example of the portal system that happens using that capillary network. First question, what is the other portal system that is located in your abdomen? Is that the stomach portal system or the hepatic portal system? It looks like this. The answer is it's your hepatic portal system. It's carrying nutrients from your intestines up into the liver through a vascular system. So the hepatic portal system, drugs, nutrients, and even toxins go through the hepatic system for detoxification. And the portal system in the brain is that hypophyseal portal system carrying hormones from the hypothalamus down to the anterior pituitary gland. Now, the posterior pituitary gland communicates in a different way. It does have the stalk, but within that stalk are the axons of these neurosecretory cells. And they're taking the hormone that's created by those neurosecretory cells of the hypothalamus, taking them down the posterior pituitary gland for storage. And they only get released into your bloodstream when the hypothalamus tells the posterior pituitary to do it. And those hormones include oxytocin and ADH, or antidiuretic hormone. The way I remember the communication between the hypothalamus and the anterior and posterior pituitary gland is using the pirates and the black pearl. Think of the captain as having two first mates. On the black pearl, he had a captain that was a human in the anterior pituitary, and the posterior, sitting posterior to his head on his shoulder, is the monkey. So he has two first mates. He communicates them in two different ways. The first captain, the human, is sitting anterior to him or stands in front of him. So that's represented as like the anterior pituitary gland. So the anterior pituitary gland communicates in a different way in that he has this vascular portal stalk. He receives the hormones that the hypothalamus has made, and then he creates his own hormones. In contrast, the posterior pituitary gland is communicating with that neural stalk. The hypothalamus, the captain hypothalamus, creates his own hormones, drops them into the posterior pituitary gland for storage only. And then when they're ready to be used, the hypothalamus allows those hormones to be released. So as an example, for the posterior pituitary gland, the hypothalamus releases the gonadotropin releasing hormone. So all of the hormones that the hypothalamus creates are for the anterior pituitary gland are said to be releasing hormones. So you'll see gonadotropin releasing hormone or thyroid releasing hormone. So he releases those orders, and in this example, he's releasing gonadotropin releasing hormones. They go to the posterior pituitary, the anterior pituitary, and it produces luteinizing hormone and follicle stimulating hormone. And those hormones act on either the testicles or ovaries, depending on the genetics, XX or XY. And then those gonads release or create their own hormones. For instance, the testes are creating testosterone, and the ovaries are creating estrogen. Now notice that both men and women produce luteinizing hormone and follicle stimulating hormone. It's just that those hormones act differently in those two different sexes based on whether or not they're testes or ovaries. And then the other thing that happens is that when there is enough hormone that's being produced, enough testosterone, enough estrogen, these hormones tell the anterior pituitary and the hypothalamus to stop. When enough is enough, it shuts off. And remember, shut off or shut up, negative feedback loop. So the next question. The hypothalamus releases gonadotropin releasing hormone. The Pituitary releases LH and FSH. Which lobe of the pituitary is responding? Anterior or posterior? And the answer is anterior, sitting in front of him. All right, let's just segue just for a minute. It's interesting. What else do you need to attain puberty besides gonadotropin releasing hormone, FSH, and LH? Your possible choices are gut bacteria, adequate sleep, or both. The answer is both. They did studies on mice, conventionally raised mice born normally, have normal gut microbiome. And then they had another group of mice that were born through a C-section, sterile, kept germ-free, which means they had no gut bacteria. What they found is that they could not have completely separate sexual development. So essentially, the males look like females and the females kind of look like males. It's called sexual dimorphism. So it happens without your microbiome of your gut. Your DNA receptors are not activated. Growth hormone is reduced, and you miss out on normal puberty. The other thing that happens during puberty, if you notice, they sleep a lot. Teenagers require 10, 11 hours of sleep, and it's only during healthy sleep that those hormones are released. And so those fluctuation, those oscillation of hormones only happen during those sleep cycles. However, it's when you get out of puberty that you can start having the hormone release during other cycles of the day. All right. Next question. The hypothalamus and pituitary stop production when estrogen, testosterone levels are normal. What type of feedback is in play? Short-term memory quiz. Remember, it says to shut down, so that is negative feedback. So all of this negative feedback, positive feedback, the attempt is to maintain homeostasis. Remember the homeostasis or the negative feedback when everything's told to shut off. And then the positive feedback, just keep going. Seen with oxytocin and the blood clotting cascade. Case presentation. Actually, this is a patient I saw in the emergency room. It was a really hot day. They're rugby players. This rugby player was taking some medications, but specifically, I know he was taking Sudafed along with other things. When he came into the emergency room, his body temperature, his core body temperature was 107 degrees. He was comatose. I intubated him and we started lavaging everything, bladder, esophagus, rectum, to try to cool him down as quickly as possible. He was sent to the intensive care unit where he started bleeding through his GI tract, sloughed the lining of his gut, and then he bled to death within 2 hours despite massive blood transfusions. This is an example of homeostasis where the body temperature needs to be very closely controlled. Too hot, and you get these release of toxins, blood vessels leak, coagulopathy, blood clotting cascade is impaired. And then, of course, hypothermia, you can see arrhythmias, cardiac arrhythmias. The other thing that affects body temperature, of course, is hyperthyroidism, meaning too much metabolism, hypo, too little metabolism. So what endocrine gland controls metabolism? Parathyroid or thyroid? Answer is thyroid. I think I just said it like 30 seconds before. With hyperthyroidism, get a high metabolic rate, weight loss, hyperactivity, intolerant to heat, and you can develop a goiter as well, which is a very large thyroid gland. Hypothyroidism is meaning low. People have weight gain, sluggishness, and they're very sensitive to cold, as depicted by these images. These are a couple examples of some famous people. Ronnie from Schitt's Creek and Marty Feldman. This is a disease called Graves' disease. It's an autoimmune disorder. And the bulging eyes, actually, once you get to this point, the only way to fix it is to remove those fat pads behind the eyes, which is not a very easy operation. Most people choose not to have surgery. And then the possibility of hyperthyroidism is thyroid storm, which can result in hyperthermia, and also what we talked about with that rugby player. Hypothyroidism, a lack of thyroid releasing hormone from the hypothalamus. The anterior pituitary may not produce thyroid stimulating hormone. These are possible causes of it. Or the other possible cause is that the person gets absolutely no iodine in order for the thyroid gland to produce T3 or T4. And the treatment is and the other possible cause is that they've had surgery, so that they've had their thyroid removed, maybe for thyroid cancer. And so they don't have a thyroid to produce the T3 and T4. Iodine is the main component of creating T3 and T4. What will happen to the thyroid gland if the iodine intake is low? Will that gland get smaller, get larger, or will it stay the same? The answer is it gets larger. The reason why is that the hypothalamus recognizes that active T3 and T4 is not being produced, and it'll keep flogging that poor gland. These are actually some images of patients seen in rural Uganda with goiters. They're getting enough iodine that they can still be euthyroid, which means they're not hypothyroid, but their glands are very large from trying to produce T3 and T4. So the low iodine increases goiters. The hypothalamus keeps driving the pituitary, and the thyroid to make T3 and T4. So there's very little active T3 and T4 to give a negative feedback to tell it to stop. So the gland keeps getting larger and larger. This was a problem back in the 50s in the United States until they started adding iodine to salt. The other thing that makes things worse in these areas, low resource settings, is that they eat a lot of cruciferous vegetables. And this is some couple little boys selling cabbage on the side of the road. And so it competes for iodine uptake. So here is an iodine-rich diet. Iodized salt started in the US in the 50s. And this is an iodine-poor diet where the cruciferous vegetables and then the non-iodized salt. Okay, let's get on to the next gland. Living side by side, the thyroid and parathyroid glands manage the blood levels of what mineral? Calcium, iron, or magnesium? And by the way, this is the anterior view of the thyroid gland. And this is the posterior view showing the posterior side of the trachea. And these are the little parathyroid glands. So calcitonin hormone, the way to remember calcitonin is calcium to bone. Other ways of getting rid of calcium is through excretion through the GI tract or kidneys. But the way to remember what calcitonin hormone does is remembering calcium goes to bone, calcitonin, calcium to bone. So it detects the high levels of calcium and reduces it. The parathyroid hormone is the yin yang. It raises, it senses when serum levels are low and it raises calcium. So it'll either reabsorb calcium from bone or it'll improve absorption from the gut. So again, these are the different ways that calcium brings levels back up. Bone reabsorption, gut reabsorption by gut calcium absorption, or reabsorption at the kidneys. And this is the posterior view using the Visible Body app to take a peek and highlighting the parathyroids in blue. So the thyroid gland is an extremely vascular structure, and it's producing hormones both for metabolism, T3 and T4, but it's also managing calcium through using calcitonin. Both of these are negative feedback loops. When the levels get high enough, it shuts off production. Do you remember which body functions are dependent upon a normal blood calcium level? Heart, muscles, blood clotting, or all? And the answer is all are correct. And these are just showing the different ways that calcium is used. Muscles, cardiac conduction, nerve synapses, blood clotting. So in summary, the hypothalamus directing the anterior and posterior pituitary in different ways, the thyroid gland and parathyroid gland. The hypothalamus has these releasing hormones, and they're telling the anterior pituitary to create their own hormones. And remember, the posterior pituitary, sitting posterior to the captain's shoulder, is a storage only. And he's storing oxytocin and ADH. So all of these shown are under the direction of hypothalamus, 2 different lobes, 2 different types of communication, and all except that are shown here, oxytocin, are all by negative feedback loops. And this is going to be on the PDF that is included under the link in the messages. So to refer to that, you want to print that out. Just remember, all of these are made, all the orders based on feedback loops, negative, released until blood vessels, the blood levels are sensed to be enough, and positive are orders released until word gets back that the job's finished. And that's it. Any questions, please comment in the, put your comments in the comment section,